Guess what? Just because you've had a C-section does not always mean that you can't have a vaginal birth in the future. Let's talk about it. If you're new here, hi, my name is Bree. I'm a 29-year-old labor and delivery nurse, and I am your laborhood bestie. Send this video to someone you know who's had a C-section. So what am I talking about? VBAC. VBAC stands for Vaginal Birth After Cesarean. It's when a woman who has delivered a baby via C-section previously decides to try for a vaginal delivery in this current pregnancy or a future pregnancy. VBACs are safe and appropriate for a number of different patients. The American College of Gynecology supports VBACs when a patient is a good candidate. So what makes a woman a good candidate? There are 6 big things your provider will consider to determine whether or not you are a good candidate for a VBAC. The first one is the type of incision that was made on your uterus during your C-section. If it was a low transverse incision around your bikini line, that's generally safer than if you had what we call a classical incision on your uterus, which is vertical. Your provider will also consider why you had a C-section previously. They would also consider how many C-sections you've had previously, your overall pregnancy health, and whether or not your hospital has resources for emergencies, just in case. And a successful VBAC can mean lower risk for infection, shorter recovery, less blood loss, and of course, avoiding another major abdominal surgery. Especially if you already have kids, healing is gonna be a little bit more difficult. Now, Bree, that's all great, but what are the risks? The main risk your care team will monitor for is uterine rupture, which is extremely rare but can be serious. This is why it's very important that VBACs only happen in hospitals that can handle obstetric emergencies of that caliber. So if you've had a C-section in the past and you're open to the idea of trying for a vaginal delivery, ask your doctor if you're a good candidate for a VBAC. As always, meet me in the comments with your questions. Bye.